Obesity is a big topic. It's an area that we could probably spend not only a whole day, but probably a full week discussing. It's a complex topic, but it's a personal topic. Here in Korea, 37% of Koreans today have obesity. That's a third of the country. It's almost half of Korean men that have obesity today. And that's people. That's brothers, sisters, mothers, cousins. It's the cashier that works at the CU. It is colleagues in the office. And this is a disease that affects their daily lives and their daily reality. And I say that for two reasons. One is it's a people challenge, and the other is that partnership, I think, is critical. It's partnership across private, but also public partnership. These are very, very big problems that will require the Korean government, global organizations, also private companies like that I represent, to work together in order to solve such big problems like this. And it's also, I would say, a global challenge, obesity, a global problem, but it's also very much a local issue. How obesity occurs and why it occurs is very cultural. It's about families, it's about eating standards, it's about genetics, it's about local communities. I had the opportunity with my team, some of whom are here today. A few months ago, we were in Gangbuk, which is one of the poorest areas of Seoul, and had an opportunity to meet with a man with obesity, with very low income, no family in Seoul, no social network and community, and to listen to some of his challenges about basic things like cooking for himself when he has mobility issues due to his knees, and knowing what food to cook, healthy food to manage his illness. So obesity is a global disease, it's a global problem, but it's also very much a local problem. And that's, let's say, one story, but there are 16.6 million stories like it in Korea. It's a huge amount of people, as I said. Unfortunately, it's also growing. It's growing globally, and it's also growing in Korea. So you can see here globally, it's almost 1 billion people today that have obesity. In Korea specifically, in the last 3 years, as most of you in this room know, the Korean population has declined by 100,000 people, but the number of people with obesity in Korea has gone up by over 1 million people. And the number of people with diabetes has gone up by 1 million people. So these are really, really national level challenges that need to be addressed, not only with companies like ours, bringing innovation, but also in partnerships and social projects and working with local governments. Big numbers mean that it's something very unique. 1 billion people globally also means that for this disease has been recognized as a pandemic. As I said, I've been working in obesity for about a decade. I'm in a sense excited about the future because it's one of the moments since I've been working in it where obesity is covered very widely in the media as a really big issue and a really big challenge. I think that's a good thing. John will cover a little bit later some of the stigma and the bias, which is very, very high with this disease. It's exciting to see it covered, but it's still not really recognized as a disease. And I will emphasize it very much is. You can see here 200 different complications related to obesity. It's one of the biggest predisposing factor to cancer. More than half of Koreans today that have diabetes, it's a result of obesity. And for Korea specifically, as an aging population with increasing obesity rates, you can see here that 80% of deaths in Korea are related to non-communicable diseases. So it is a disease, and it's a disease with some pretty serious consequences. If you look from a cost standpoint, when you have a problem that affects so many people, the cost is huge. So you see some of these global numbers, but also the local numbers. In the US, they've identified solving the obesity epidemic as maybe being one of the biggest potential GDP growth drivers. And here in Korea alone, you can see the cost is estimated at $10 billion US, 10% of the entire Korean GDP. So it comes with a very, very significant price tag that needs to be addressed. But as I said at my opening, it's also a very personal story, actually, because you can look at a number like 16.6 million people, which is huge. But for those sons, daughters, mothers, and friends, this is a disease that reduces life expectancy by 3 years and results in considerable bias and misunderstanding about how the disease works and what it takes to cure the disease within people. And unfortunately, both globally and here locally in Korea, it's a big problem. It requires big solutions, and so far we're failing actually at those solutions. As I said, look at Korea specifically, where there was a target set to reduce obesity in Korea by 6.7%, and obesity has actually increased by 3.6%, reaching almost 38% today, and it continues to rise. And maybe one very sad statistic is that in the last 5 years, childhood obesity in Korea has gone from 10% to 20%. So it is a growing problem, and we are failing to bend the curve, and that requires, I think, partnerships and solutions working together to solve it. One question that's always asked, is why is it such a hard problem to solve, and what drives it? The challenging answer to that question is it's both genetics and socioeconomic factors. So it is true that people are born with a certain genetic predisposition to obesity that makes some people more predisposed than others. But as I mentioned before in the story of that patient in Gangbuk, it is strongly related to income levels, communities, families, eating standards, culture, that all conspire to make it a very, very challenging disease to manage, and in my opinion, a very personal disease, actually, in terms of how you challenge it on an individual level. So what that means is that treatment is very important, and we have a number of us on the panel here today that are developing innovative treatment tools for patients. We're extremely proud of that innovation. That being said, treatment will never be enough in obesity. Prevention has to be at the core. The numbers are too big, and managing this disease through prevention will always be more impactful than managing it through treatment. So certainly for us as Novo Nordisk and as an organization, we're committed to an enormous amount of research and development in terms of tools and treatment solutions, but we're also committed to prevention. So we actually have an organization within our organization, which is a prevention unit, transformational prevention unit. And we have kicked off partnerships with a number of organizations. I'll cite maybe one on a global level, which is a partnership with UNICEF globally around children with obesity and trying to address some of those dynamics, similar in Korea, where the amount of childhood obesity continues to go up. And the other project which is, let's say, very important for me also personally here in Korea is we have a project called Cities Changing Diabetes, and that's a partnership with the Seoul Metropolitan Government to address some of these local issues and challenges, specifically very locally working with communities here in Korea around prevention and treatment of this disease. So as I said, obesity is a very global disease. It's a scary global disease now that probably represents one of the biggest challenges for the developed world, affecting about 1 billion people. And global partnerships are critical and I think really important. And I think the recognition of the disease is excellent. That being said, I think local treatment and management is critical. And for us in Novo Nordisk, we have a number of partnerships, as I mentioned, with Seoul Metropolitan Government. We also have a partnership with Kakao Healthcare around designing AI digital solutions to try to manage these chronic diseases. And also partnerships with an organization called, that many of you probably know, Kitty, around trying to create a more dynamic biotech environment here in Korea. So global partnerships are important, but obesity is very local and it's very, very personal. And managing it is very, very personal. And the personal impact to many of the families of everyone that you've met, your families, people you've met, people you work with, that reality day-to-day living with obesity is a big, big challenge. So thank you very much. It's a great opportunity to be here.
Good afternoon, everyone. It's a pleasure to be here. I'd like to today talk about the stigma that surrounds obesity and some of the implications specifically for here in Korea. As mentioned, I'm the general manager for Lilly Korea. I've been with Lilly 26 years of my career. And just a little background as a personal story. I'm born and raised in the state of Indiana. I grew up in the city of Indianapolis. And if you know anything else about Indianapolis, you'll know the Indianapolis Motor Speedway. Indiana is also famous for basketball. And it's the home of Eli Lilly and Company and our global headquarters. The thing you may not know about the state of Indiana, and something we're frankly not proud of, is that 2 out of 3 adults are overweight or obese. Now, the slide says the US. This is specific to the state of Indiana. And that is an astonishing figure. 66% of people are overweight or obese. Now, it becomes a personal story when I think about my own family and kids. I have 4 children, and what that statistic means is they actually may grow up in a world where their life expectancy is shorter than the generation before them. And you think about the scientific advancement that we've made as a human species. To me, as a parent and someone who wants to deliver something of value to the next generation, that's unacceptable. I'll also have you think about the 2 short kids in the middle. They're twins. And their entire life, they've been essentially the same height and same weight. And imagine the scenario where one of them becomes obese. And imagine one of those twins exceeds a BMI of 30 or more, while his brother stays normal weight. Now imagine that same obese child loses his weight, and he's now once again the same size as his brother. His metabolic profile, his insulin sensitivity, his likelihood of gaining weight in the future, even the size and shape of his mitochondria in the fat cells are going to be different as a result of that history. And as a parent, again, that's a scary thought and something that fundamentally obesity changes the way his metabolic profile compares to his brother that was always of normal weight. And that's why obesity really needs to be thought of as a disease that needs to be medically treated and prevented in the first place. Now, Eli Lilly and Company, as I mentioned, is a company that focuses on innovative medications to treat some of the biggest and most important global health needs. We were founded nearly 150 years ago, and we've been, thankfully, a leader in diabetes as a therapeutic area for over 100 years. It was Lilly that was able to partner with the scientists at the University of Toronto, Banting and Best, who discovered insulin, but it was Lilly who was able to develop a manufacturing process to first make insulin available to the world. And here in Korea, we currently have over 36 clinical trials in areas of diabetes, obesity, immunology, and other therapeutic areas. And I want to address this concept of stigma in obesity. This is specific to here in Korea. Over 50% of adults face stigma in their workplace. Nearly 70% have bias that comes from their healthcare professionals who are there to help treat them. And this stigma ultimately impacts healthcare policy and limits access to obesity management and support. And so this is something that we, as a country and as a society, need to address. So let's talk about a few aspects of stigma of obesity here in Korea. One is many people think of obesity simply as excessive weight. And this is most commonly seen in conversations around obesity for weight loss, and you hear that in cosmetic clinics all over the country. And usually people are focused on looks and cosmetic purposes rather than the health or overall health outcomes of what they would face in the future. When you look at those with obesity, 50% of those with obesity in Korea don't recognize they have a disease, and only 1 in 5 actually visit hospitals and clinics for their condition. You often hear obesity is simply a lack of willpower. No other disease that I'm aware of do we say you just need to do better and try harder. But oftentimes that's the way we think of people with obesity. They're lazy, they lack self-control, and ultimately that type of stigma is detrimental for them ultimately to get the medical benefits and treatments that they need. If obesity is about health and cosmetics, then government intervention and support is unnecessary. Unfortunately, one of the first comprehensive plans to address obesity in Korea failed to meet its targets, but this is a challenging problem that takes dedication and continuous effort to make it happen. And so we do need to see the Korean government introduce the second comprehensive plan and reintroduce measures to address obesity here in Korea. One example of that is you actually see very different diagnostic criteria from the national health exam that everyone undergoes from the obesity diagnostic criteria that you see in this country. And again, to develop effective nationwide treatment patterns, there needs to be a standardized and national approach to the treatment of obesity. So let's talk about a few of those truths around obesity. Sasha mentioned earlier, obesity is a chronic disease. And if you think about the example I gave earlier of my twins and their metabolic profile changes over time, I think that's easier to understand in that context. It was originally classified as a disease in 1997 by the WHO. You see higher rates of BMI are associated with decreases in life expectancy. So obesity directly impacts a patient's longevity. It's associated with over 200 disease complications. We used to think about alcoholic fatty liver disease as a complication of severe alcoholics. But fatty liver disease is on the rise globally as a result of obesity. And you think about some of the most common health conditions like diabetes, high cholesterol, hypertension, and myocardial infarction, and all of those are at increased risk if someone has obesity. So this is a problem that as a society, we need to help address. It's multifactorial in nature. There's a number of causes from genetic to behavioral to environmental, but as a result of that, it needs comprehensive and multidisciplinary approach for prevention, education, and treatment. You also see obesity impacts different parts of society differently. And so you have different inequalities across Korea. Particularly, the lower your income, the higher likelihood you are for obesity. The last time I checked, a lot of the cosmetic clinics that are focused on obesity are probably located in the neighborhoods, maybe where they're least needed. And those neighborhoods that probably have the greatest need may lack some of the resources and support to treat those patients effectively. And obesity is not just increasing in Korea, it's increasing at an accelerating rate. In the first 5 years on this chart, you see a modest increase in obesity, and over the last 8 years, you see the rate of increase significantly go up. So that's where we need government and a broader support to address this challenge. The value for government can be seen in its socioeconomic impact. The impact of obesity is actually greater than the socioeconomic impact of cancer. And if you're able to address obesity and reduce the prevalence, you can have significant benefit from a socioeconomic perspective at a nationwide level. So what do we need to do to address this stigma? One is we need to look at obesity as a chronic disease. Two, it needs all of our help from a society perspective, and it needs government intervention for its healthcare purposes. So 3 points on how we as a society need to address obesity. Number one is we need to address this in the culture and education. We need everyone to understand the complexity and drivers of obesity, to focus on prevention and ultimately healthcare. Secondly, we need policy measures that prevent obesity and provide comprehensive management at a nationwide level. And we need medically driven, multifunction obesity care that is evidence-based. As a company, we're also committed to continued research and development in this space. Eli Lilly spends nearly $9 billion a year in research and development. 40% of that goes specifically into metabolic health. And we've seen significant investment in manufacturing capacity to provide safe and stable drug supply around the globe. So in closing, we like to think of Lilly as a medicine company. And medicine is broader than simply just a drug. And obesity is one of those areas where you need a broad approach of education, prevention, and medical care to prevent obesity in the future and to treat those who suffer from that today. And I think it's our responsibility to make sure that we deliver that better society and better health to the kids of the generation of my children and for all of those in their generation. And with that, Professor O, thank you very much.